Hi everyone, my name is Christina and I'm a psychotherapist here at My Therapy NYC. In this video blog, I want to talk to you about parenting after trauma. Becoming a parent is supposed to be a wonderful, exciting experience, but for some people, it may cause stress and fear. Our experiences form the foundation we take into all future relationships, to include parenting, and for some, their experiences haven't been so positive. They may have included neglect, separation, domestic violence, abuse, suicide, or disturbing accidents, all of which are various forms of trauma. These can also be considered adverse childhood experiences and develop into complex post-traumatic stress disorder if not addressed. Adverse childhood experiences, or ACEs, are potentially traumatic events that occur in childhood from birth to 17 years old. These events challenge a child's sense of safety, stability, and bonding with their caregiver. Some may have experienced multiple ACEs throughout their lives, while others may have experienced multiple ACEs during one specific time frame. Studies show that children of parents who have experienced 4 or more ACEs are twice as likely to develop ADHD and 4 times more likely to develop a mental health disorder. Complex post-traumatic stress disorder, or CPTSD, is a severe form of PTSD. It describes a lived experience of surviving repeated and prolonged abuse, neglect, abandonment, and/or engulfment. Unresolved trauma in parents can lead to CPTSD. This can also show up in parenting through increased aggravation, the constant feeling of being on edge, unintentional neglect, fearful control, and in dangerous cases, physical abuse. Childhood trauma can influence parenting and attachment behaviors in many ways. One way is through parental avoidance. This happens when a parent avoids the feelings, emotions, and activities a child is engaging in or experiencing. This can be triggering for the parent as it surfaces memories from their own childhood and provides limited emotional ability to attend to anyone else's emotions and needs. Avoidance affects the parent-child relationship by making it difficult for vulnerability and emotional soothing to take place. Over-sheltering and over-controlling is also common in parents with trauma because it feels scary and unsafe to not have control. These parents have an extreme drive to protect their children from their own personal experiences. This is maladaptive, meaning it keeps the children from properly developing by not allowing them to assess risk independently. Children can also become rebellious and use negative behaviors to manage their emotions, even as adults. It is difficult for parents with trauma to be attuned with the emotional needs of their child. Dysregulation, or the inability to regulate emotions, can cause children to develop anxious and avoidant attachment behaviors. Anxious children tend to be overly needy and attention seekers, while avoidant children tend to be emotionally withdrawn and distant. These attachment behaviors can continue into adulthood and are likely to develop into unhealthy relationships. I'm here to tell you, you are not defined by what happened to you. Parenting does not come with a manual, and it is never a completely problem-free experience. Trauma survivors often experience hypervigilance to avoid repeating the same patterns of events they went through. There will be mistakes that cause feelings of guilt and inadequacy at times, which is all normal. Here are some ways to engage in mindful parenting after experiencing trauma. First, reparent yourself. Surround yourself with a safe, happy, healthy, and loving environment. Live the values you need to support personal growth and healing. Next, be honest with what happened in your past. Do not avoid it. Do your best to limit shame and guilt around what you experienced. Separate from the past and tell yourself you are not what happened to you, nor are you responsible for it. Live in the present with your experiences in the here and now. Regulate your emotions to better support your children in their emotional needs. Also, if this applies, do not blame your parents. They were humans with flaws themselves. Name the negative experiences you want to heal and the positive experiences you want to emulate for a healthy family dynamic. You can't always heal alone. Remember, sometimes addressing past experiences can seem more powerful than you thought. They can also bring up more unresolved issues that you weren't aware of. There are experts who can help you navigate through your journey towards healing. If you are a parent and you find yourself struggling with past trauma, it is okay. This does not mean you failed as a parent. Remember, no parent must be perfect to be the parent that their child needs. Thank you so much for watching. I encourage you to comment on this post with any thoughts or experiences you have. All responses are appreciated. If you're interested in more videos like this, please check out our website at mytherapynyc.com. Feel free to check out our services as well, which include trauma treatment. Thanks again for watching.